The COVID-19 pandemic has interrupted our lives. Everyone has been impacted, but Indigenous, racialized, and immigrant and refugee communities in Manitoba and Canada have been disproportionately impacted by COVID-19. Let's take a moment to understand how structural barriers and systemic racism have put some communities at greater risk. People who are affected by structural barriers and systemic racism are more likely to suffer from poor health outcomes and shorter life expectancies. Housing, income, and employment, access to health care and education, and other factors determine who has access to the resources needed to create and maintain health and well-being. These are known as the social determinants of health. Let's take a closer look at access to health care, which is one of the social determinants of health. Our health affects virtually every other aspect of our lives, whether we can work or study, care for our families, actively participate in our community, and how independent we are. Indigenous, racialized, and immigrant and refugee communities often experience health problems that could be addressed with regular and equitable access to health care, from higher infant mortality rates to higher incidences of illnesses, including diabetes and heart disease. Generally, less than half of health outcomes are directly impacted by access to healthcare services. The other social determinants of health that we have discussed in this video series influence as much as 60% of a community's health. However, equitable access to healthcare services helps to diagnose health problems quicker, lowers mortality rates, lowers rates of multiple health issues, and leads to improved physical, mental, emotional, and social outcomes. In contrast, discrimination and barriers to accessing healthcare services magnify health challenges that are already significant among Indigenous, racialized, and immigrant and refugee communities. Indigenous, racialized, and immigrant and refugee communities, as well as women and people with disabilities, are especially likely to have less access to health and social services. Other challenges include language barriers, lack of health care available within a reasonable distance, or overcrowded services. In addition, social determinants of health can reduce people's healthcare literacy, such as knowing where to go for help or how to express their concerns to a healthcare provider. Even if these communities can access healthcare services, discrimination affects the level and quality of care they receive. For example, evidence shows that Indigenous peoples experience challenges in accessing healthcare, including racism and discrimination, long wait lists, and culturally unsafe care. Negative experiences with healthcare providers impacts future access to healthcare. Evidence shows that many members of Indigenous and racialized communities will avoid healthcare because of having faced racism and biases in the past, sometimes putting it off until they are in emergency situations. Also, racialized migrants with temporary immigration status are not eligible for provincial health care, such as migrant workers with a work permit of less than 1 year, international students, and undocumented residents. Uninsured and undocumented residents may avoid health care in Manitoba due to the costs they will incur, and also because they fear detention or deportation if healthcare providers inform immigration authorities. As with other social determinants of health, equitable access to healthcare doesn't just help the affected communities, it helps our society as a whole. If we eliminated all barriers to access quality healthcare, less people in our communities would require emergency and long-term care for preventable conditions. Achieving health equity will improve the health of all Manitobans. Now that you have learned more about one of the social determinants of health and how this puts Indigenous, racialized, and immigrant and refugee communities at greater risk of COVID-19, we call on you, community members of Manitoba, to learn more about structural barriers and systemic racism in Manitoba. Many, burdened by the disproportionate impact of COVID-19, feel their voices have not been heard. Together, we must ensure Manitoba's COVID-19 response addresses the unique needs of all communities. We are all responsible to speak out and stand up against racism and discrimination.